Have you ever wondered how your mind affects the body and vice versa? Remember that one day when you felt your chest get heavy after a difficult conversation, or when you were so angry because you were hungry? So let's deep dive into the mind body connection with us today on the Safe Room podcast, where the episode talks about the what and why of the mind body connection. And we'll be discussing what is really the mind body connection about, how this connection has been deeply embedded in our roots, some important research and work in the theme, the mind body connection. This is a topic very close to my heart. I know if I'm starting a podcast, this is the topic I need to start with, simply because the knowledge has shifted and transformed my practice, both as a therapist and for my clients, something which needs to be shared with more and more people. Here's hoping you benefit from it as well. Hi, I'm Tanvi, a therapist and founder of a therapy space, The Safe Room, and a person deeply, deeply curious and passionate about my work. And this is the Safe Room podcast, where we talk about all things mental health, through its complexities and layers from a therapist with my experience in the journey, other experts in the field with relevant research to give you valuable insights. And no, mental health doesn't have to be intimidating, unapproachable, and I promise that the information will not be ambiguous with the pressure to keep it concise like on social media. So grab a cup of tea, find a comfortable spot, and let's engage in a conversation about mental well-being and growth. You can find out more about me or my organization at the website www.thesaferoom.in, social media handle thesaferoom.official, and email connect@thesaferoom.in. Have you ever felt your stomach twist when thinking of a decision to be made? Have you ever noticed a part of your body, say your back or your head, hurt after a stressful situation or meeting with a particular someone? Or even felt butterflies in your stomach when thinking of your loved ones? That's how the mind affects the body. But the body can also affect the mind. Say, have you ever felt low when you are experiencing a flu? Or have you felt annoyed for seemingly no reason at all? And then feeling calm when there's food in your stomach? When you fracture one of your hands and you can't seem to do things the way you used to before. So you feel really angry, helpless, and maybe even irritated. And these are all the ways of the mind-body connection manifesting in our everyday lives. If your mind stands in threat, say a snake, it will immediately send a signal to your body to move away, supplying your body with more adrenaline, cortisol, pumping the heart faster for more blood supply, more oxygen to let it deal with the threat. But your body also has the ability to send signals to your brain. For example, your body is feeling very relaxed. Even if you have a lot of work deadlines, by deeper breaths, relaxed muscles, and your body is able to then tell your brain, hey, we've got this, you got nothing to worry about, it's all okay. Both the mind and body are intertwined with each other. But it wasn't always believed so. René Descartes was a French philosopher, scientist, and mathematician who gave us many, many things, leaving us with the quote, I think, therefore I am. But why are we talking about him in this podcast? He made some remarkable contributions in the fields of philosophy and mathematics, being regarded as the father of modern philosophy. But he also left a strong impression in the field of psychology. This quote that we mentioned, I think, therefore I am, is a reflection of his views on the mind and body, called the mind-body dualism theory, where he believed that the mind and body can exist independent of one another. This theory, what it did was introduce a problem of incommunicability, especially difficult to solve for psychiatry and psychology about mental illnesses. So it made people find it really, really hard to understand mental health. In this context, health was seen as something that happens in the absence of illness. It mystified mental health. You can see this how it was laid out back then was if you and I were going through a mental illness, even trauma in the 1800s was seen as a disorder of the brain which could not be cured. So if we were experiencing something back then, we would just be labeled as mentally sick. Something nobody would be ever able to understand what is happening to us, seeing it simply as an illness in a vacuum, unrelated to our life. So who do you think gets all the power in this dynamic? The power comes from the doctor or to the patient? A lot of work in the field of mental health early relied on this biomedical framework, which meant that the clinicians would regard patients as objects, ignoring the possibility of the subjective experiences can be important for the recovery. And with these criticisms, a new model was developed by a person called George Engel called the biopsychosocial model. Sounds holistic already, right? This new framework integrated the understanding that a patient's subjective experiences along with the biomedical data gives a more comprehensive outlook, such as through the inclusion of the psychological and social factors. This model laid a foundation for us to be curious and delve into the mind-body connection today. Many therapeutic modalities till date ignore the mind-body connection, dealing with the mind as a supreme being, which is in control of everything, neglecting our bodies in the process and not giving it the importance it deserves. But did you know that the mind-body connection is not something that has just come to light recently? It is traced back thousands of years ago. The ancient wisdom from the Taoist way of life believed that the cornerstone of a happy life was to have a relaxed mind and a free-flowing body. And boy, were they right. It never removed the body from the equation of healing. Eastern philosophies from Buddhism, Chinese traditional medicine, Taoism all pay great attention to the mind and body in living a harmonious life. Look at yoga. It goes back to 3,000 years and focuses both on the mind and the body. Research shows yoga having benefits extending to the mind and body, enhancing muscular strength, flexibility, promoting respiratory cardiovascular function, promoting recovery from and treatment of addiction, reducing stress, anxiety, depression, chronic pain, even improving sleep patterns, can enhance overall well-being and quality of life. It truly extends to a holistic outlook on health. Yoga is proof that the understanding of the mind and body goes back to thousands of years, remaining in significance till today. Now let's talk a little bit more about important people and research with some influence around this topic on the mind-body connection. Throughout the career of Dr. Gabor Maté, who's a renowned physician, speaker, and best-selling author, he has been a passionate advocate for understanding the profound connection between psychological well-being, emotional trauma, and physical health. In one of his books called When the Body Says No, Dr. Maté delves into the intricate relationship between psychological stress and physical health and highlights just how unresolved emotional issues and chronic stress can manifest as physical illnesses. Since he was a physician, he started noticing how many of his patients had a history of trauma and experienced emotional difficulties, and how it started reflecting in their bodies. So the book explores all the ways in which our emotional experiences, early life traumas, and even unconscious patterns of behavior can influence the development and progression of diseases. Another thing in the book that really blew my mind when I read it was how the body supports us. And it states through and through how when we're unable to set boundaries, our bodies try to do it for us, letting us know exactly where to focus our attention and what to change. So if you don't want to maybe commit to a plan that is getting made with your friends, you could notice feeling uneasy, physically too. And that is how your body is trying to tell you to set boundaries. I have professionally been a witness to this so many times in journeys with clients, looking at all the ways the body supports them and at times demands them to do things that are necessary or important. It could be about distancing self from a toxic person in their life, or say pushing things off their plate and taking care of themselves. Another person, Eugene Gendlin, a figure in this field whose contribution to the mind-body connection was truly something. He was a philosopher turned psychotherapist and worked closely with Carl Rogers, who's an important name in the field. He developed a psychotherapeutic method called focusing. No, it is not about concentration. It primarily involved diving into one's bodily experiences and separating it from the mind. And I know you might be thinking, then we just said the mind and body are connected. Yes, it is. But a lot of times when we are looking at our process, we only look at it from the perspective of the mind, knowing the body. And focusing does exactly that, bring an integrated understanding of it. So when we're able to go into the body, we're able to also understand it from the mind too. So focusing leads the process in which a person is encouraged to listen to what comes from within, looking for a bodily felt sense without intellectualizing it as an understanding of the situation. Intellectualizing is a coping mechanism which we've all used at some point in our lives. It's when we try to look at things rationally or logically, but in the process, we sometimes leave behind our feelings. In the short run, it's fine. Of course, we may need it at some time. But when it keeps becoming a habit to stay in the long run, it can hinder your mental health, even come in the way of your relationships. In the long run, if we don't address our emotions, they can build up and interfere with daily life. And it can also come becoming an unhealthy way to escape them, maybe through anxiety or panic attacks. Eugene Gendlin, when he developed focusing, looked at precisely that as a way to override intellectualizing by going into a body and connecting with your feelings. He obviously viewed the body as very, very intelligent, more than simply just the parts of our body. Looking at it as holistic in therapy, he gave the body a lot of credit and sincerely believes that the body carries a lot of information, much more than our minds can hold. So it can shift and keep changing with situations and even guide us through stuckness or confusion, which is also the basis of the book, The Body Keeps Score by Bessel van der Kolk. Both the books I talk about, The Body Says No and The Body Keeps Score, are great books for someone wanting to understand more about this mind-body connection and also trauma. Although I do have to agree that The Body Keeps Score is a bit more intense and may not be the most friendly book to begin with, you will notice that a lot of these important works and concepts are also applicable to the field of working with trauma. And that makes sense because working with trauma cannot happen without integrating the mind-body connection in your healing journey. Something I'm a firm believer of as a therapist. As we're talking more about these important figures in this field and this topic, Peter Levine is someone we have to mention because he developed somatic experiencing. Somatic, soma meaning the body, and this SE, somatic experiencing, works on the principle that one's experiences get trapped in the body, leading to some of the physical symptoms around mental health issues. Through this method, the focus became on releasing the stress from the body. It prioritizes the mind-body connection in the process of healing, addressing both the physical and psychological manifestations. The goal of somatic experiences is to build awareness toward the bodily sensations. So when they are stemming from mental health concerns, you can use that awareness to acknowledge and work through painful, distressing sensations. Has your therapist ever paused your session to ask you how you feel in the body? I know I do. And it's with this intention of addressing the feelings stored in the body as well as the mind. So the next time your therapist asks you to do so, you will know what it's about. When there was a lot of research about trauma, and when it came out, CBT was a holy grail almost of therapy. And it was saying that it works really well with trauma patients. But gradually, more and more research is coming out where we realize that trauma can actually impair your cognitive functioning. So language-based approaches or just using CBT can be ineffective for many clients. And this is something the field of trauma, making it integrate the mind-body connection more and more. If we're going to look at the mind-body connection through a neurobiological comprehensive framework, the polyvagal theory is important and that this can help you build a better understanding of your behavior, patterns, sensations, feelings, and all that which happens within, especially shifting blame to understanding to change. So as you listen to this, I hope you're able to apply it to your own life and maybe bring it up in your therapy session. At the risk of diving into science, let me expand more on this theory. It looks at the role of the autonomic nervous system, whose job is to regulate involuntary physiological processes like your heart rate, your blood pressure, your digestion, respiration. And at the core of this theory, it highlights the key part of this autonomic nervous system called the vagus nerve. The ventral vagal complex, which is the most evolved part of the vagus nerve, is responsible for promoting the feelings of safety and connection. So it facilitates social engagement, connecting with another person, connecting to surroundings, and regulates bodily functions during states of relaxation and calm. Which is why it is so important for us as therapists and for clients to look into this in therapy. In your healing journey, actually, the sympathetic nervous system and the dorsal vagal complex are activated in response to perceived threats or stressors. That is where the fight or flight, freeze responses come up. And although these responses are adaptive and essential for survival in dangerous situations, but it can become dysregulated when we're looking at trauma or chronic stress, leading to a lot of physical and psychological health issues. The understanding of the ventral vagal complex and the sympathetic nervous system are what we as therapists look at in integration of the mind-body connection. For noticing clients going into freeze or get overwhelmed as an adaptive response, helping them learn how to come back to equilibrium and feel safe. An essential contribution to the polyvagal theory was made by Deb Turner, and one of the contributions was understanding that story follows state. This concept explains that our thoughts, sensations, feelings, impulses, behavior can directly be influenced by our autonomic nervous system state. For example, if you're feeling anxious in a social setting, and in that moment you notice a person glancing towards you, it can make you feel like they may be judging your appearance or watching your every move. Yet again, driving the point home how our emotional states and responses to stress are connected to our body and is not just limited to the mind. From a neurobiological perspective, even in all my experience as a therapist, I notice very few people paying attention to their bodies, and I urge you to start listening to your body and use it as the asset it is for your well-being. So in today's podcast, we heard about how the mind and body are connected, not isolated entities, and how a shift in one will reflect a shift in the other too. Understanding this through theories, history of its roots, research, books, and the science behind it all, and some of my learnings from my journey as a therapist can be summarized in today's podcast. Your body has been speaking to you your entire life, through tension, fatigue, gut feelings, and even the way you breathe. The question is, are you listening? What if instead of dismissing your physical symptoms as just that, or reducing anxiety, just something in the mind, we can start seeing them as messages in connection with each other, directing you towards what you truly need. This week, I challenge you to check in with yourself, not just mentally, but physically too. What is your body trying to tell you? And more importantly, are you willing to listen? Thank you for listening to the podcast. I'm Tanvi. This is a Safe Room podcast. If you've taken something away from this or even enjoyed it, do share, like, and subscribe to our podcast. And if there are any questions regarding today's podcast and you want to request a topic, please drop a comment, let me know. My intention is to create dialogue around mental health and not a monologue. You can follow us for more related content on mental health on Instagram at the Safe Room _official.